This week, the Supreme Court, which is lacking a ninth justice for the foreseeable future, for reasons that most of the American public doesn't understand, since my fellow senators, my Republican colleagues, simply refuse to do their jobs. This week, the Supreme Court will hear arguments in yet another case that threatens women's right to health care. The case that the Supreme Court will hear on Wednesday, Whole Women's Health versus Hellerstedt, originated in Texas. But as all Supreme Court cases do, this case has implications for the entire country. It's part of a sustained, coordinated attack on women's rights to make personal, private health care decisions for themselves. It's big government reaching into women's homes and bedrooms, getting between the woman and their health care provider, between the woman and their religious counselor. It's reaching into women's homes, telling women that they no longer have the right to make personal, private health care decisions for themselves and to access safe and affordable care. If the court rules in favor of the Texas law, which has closed health clinics across the state. I mean, imagine that. You are a legislator taking an oath of office in Austin, Texas, to do the best you can for your state. You pass legislation that closes health clinics, not for financial reasons, but for ideological reasons. So the court, if they rule in favor of this Texas law, which, as I said, closed health clinics across the state, it sets a dangerous precedent that could lead to more clinic closures across this country. And my interest is especially Ohio, and Ohio will be hit by this too. These clinics are often the only place that women and men have to turn for their basic health services. Most of the assistance, most of the health care that women are getting at these clinics have nothing to do with abortion, but they're the kind of care that women need in these clinics. Millions of women rely on Planned Parenthood and other clinics like it for life-saving screenings, for testing, for preventive care, for treatment. In Ohio, Planned Parenthood centers provide health care services to 100,000 men and women each year. Many of them have nowhere else to turn. Many of them are moderate income women. Many of them are women working 2 jobs. Many of them go to Planned Parenthood because one, it gives good care. Second, it takes care of them in kind, decent, empathetic ways. And third, it's what they can afford. They either cannot afford that health care or elsewhere, they live too far away from another health center to have meaningful access to basic health care. But a new law in Ohio threatens that access. The bill that was passed by the Ohio legislature and signed by Governor Kasich, that's Governor Kasich of presidential primary fame, presidential Republican debate fame, signed by Governor Kasich a week ago, will strip federal funding, not only from Planned Parenthood. Why they'd want to do that is all about ideology, all about playing to their far-right political base. It will strip federal funding not only from Planned Parenthood, but any healthcare facility that could be perceived as promoting safe and legal abortion. But these healthcare clinics are mostly not about abortion. They're about providing healthcare to women, mostly to women. This includes health clinics that simply work with other providers to refer women to other facilities so that women can make decisions that should be between them and their doctors. Now, I repeat, so many of my colleagues love to talk about big government, but when big government, mostly a bunch of privileged, if I may, privileged white men on the other side of the aisle mostly, when they want to inject themselves between women and their doctors, between women and their families, between women and their religious counselors, it strikes me as, let's just say, hypocritical. Let's be clear. So we're talking about a rule that is far, far more sweeping than just defunding, that's what they like to say, defunding Planned Parenthood. You hear that if you're watching the Republican debates week after week, even when they sound like food fights, which it did last week, but when you're watching these debates, you can see whenever one of these white, privileged men, candidates running for president, and one other privileged African-American man running for president on the Republican side, whenever they say defund Planned Parenthood, the crowd goes wild. They play to that base, to defund Planned Parenthood, that base that for whatever reason with their ideological agenda doesn't seem to care much about women's health. Let's be clear, this isn't about defunding abortion. The federal government doesn't provide funding for abortion, period. I'll say that again. The federal government does not provide funding for abortion, period. Health officials in Ohio, health officials that play it straight, which is 99-point-something% of providers, real doctors, real health providers, real health care officials, they're scared the new law could take funding away from local health departments, if you can imagine that. The director of public health policy in Columbus, the state's capital, told the Columbus Dispatch the law would have a quote-unquote significant impact on their department's ability to coordinate with hospitals and insurance companies. So stand back for a second, see what they're doing. A bunch of right-wing, privileged, mostly white men in the legislature have decided that their political agenda trumps everything else, and they're willing to follow so that they can play to their far-right base, they're willing to jeopardize women's health. They're willing to go right up against what the Columbus Dispatch says. There are few papers in America more conservative than that, when they talk about a significant impact on the department's ability to coordinate with hospitals and insurance companies. Why would they do that? They do that because they're playing to this far-right base that votes overwhelmingly in primaries. She said, the director said that because the bill is so broadly written, we wouldn't be able to work with any hospital in our jurisdiction. Any hospital in our jurisdiction. This Ohio law explicitly targets critical health and health education services for women. Don't take my word for it. All you have to do is read the bill. It prohibits Ohio clinics, and this chart will show that. It prohibits Ohio clinics and hospitals from using federal dollars for, and I'm quoting directly from the bill, for any of the programs established by the Violence Against Women Act, Minority HIV/AIDS Initiative, the Infertility Prevention Project, the Personal Responsibility Education Program, the Breast and Cervical Cancer Mortality Prevention Act. Think about that. This bill prohibits Ohio clinics and hospitals from using federal dollars to implement these laws. It means that the program administered by the Administration for Children and Families in the Department of Health and Human Services to educate adolescents on abstinence and contraception for the prevention of pregnancy and sexually transmitted diseases. So this legislation that Governor Kasich signed, that these privileged, mostly white men in the state legislature, politically far to the right, the majority of the state legislature, the bill that they passed and Governor Kasich signed would mean that we wouldn't be able to use the federal dollars we had to educate adolescents on abstinence and contraception for the prevention of pregnancy and sexually transmitted infections. So what are we doing? We're saying, the extremists on the other side are saying, no abortion. Okay, no federal dollars for abortion. There aren't federal dollars in abortion, but they're saying no federal dollars to preach abstinence and to educate young people about abstinence and sexually transmitted diseases. So what gives here? What are they doing, and why are they doing this to the women in Ohio? This law bars women from accessing cancer screenings, fertility services, AIDS prevention, and help coping with abuse and violence. Do these far-right members of the legislature, do they know no low-income or moderate-income young women? Do they know no teenagers? No female teenagers that maybe could benefit, and young male teenagers too, that maybe could benefit from some of these programs, from abstinence education, from learning about contraceptions, from contraceptives, from learning about how sexually transmitted diseases are in fact transmitted. I support a woman's right to make personal private health care decisions for herself with her doctor, but no matter your personal feelings about abortion, surely we can agree, although apparently the legislature can't in my state, surely we can agree that cancer screenings and programs that have helped bring Ohio's teen pregnancy and STD rates down are a good thing. I would insert here, Madam President, that Ohio right now, and this is embarrassing for me to say on the Senate floor in front of colleagues, my state is 50th for black babies and infant mortality and 47th overall in infant mortality. 47th overall, 50th for black infant mortality. It's stuff like this the legislature does. They underfund public health, and then they undercut, because of this legislature's action with Governor Kasich's signature, they undercut the Violence Against Women Act. They undercut Minority HIV/AIDS Initiative. They undercut the Personal Responsibility Education Program. They undercut breast and cervical cancer mortality prevention. They undercut Infertility Prevention Project. I just don't get it. Cutting those services.
The senator's time has expired.
May I ask you to send for an additional 5 minutes?
Without objection.
Thank the presiding officer. A woman in New Carlisle wrote to me saying, there was a time when I could not find full-time employment. I didn't have health insurance. I was not eligible for any assistance from the government. My husband and I were newly married, trying to build a responsible life together. I was 21. I had a family history of breast cancer, so access to health care was crucial for me. Planned Parenthood was the only place that would help me look after my health and plan my own family and lifestyle in a way I could afford. Another woman in Boardman, went on to say, Planned Parenthood made an impoverished young woman feel safe and comfortable and valued. Another woman, Boardman, Ohio, wrote, along with many other women, I was treated at Planned Parenthood. I received a referral to a specialist, which saved my reproduction. Another woman wrote saying she had a child at 13, gave the child up for adoption. After that, she made the choice to get educated about family planning and birth control. She couldn't afford a family doctor, so Planned Parenthood was where she turned to make sure she never had to go through that experience again. Young woman from Columbus told the Canton Repository newspaper while she was speaking at the State House last month, half the lawmakers looked as though they were about to fall asleep. Many were looking at their cell phones. They wouldn't want to listen to a young woman, perhaps a young low-income woman, talk about her personal life and what Planned Parenthood meant to her. What's happening is not all that different in Ohio from across the country. An organized attack on women's rights to make health care decisions for themselves. It's not about health or safety. Just look at these examples. It's about politicians thinking they know better than women and their doctors. It's happening as we speak. These so-called trap laws in Ohio and in dozens of other states have created gaps in care that threaten women's ability to see the providers of their choice. Health clinics in Texas have shut their door. If the Supreme Court upholds the Texas law being challenged, the remaining clinics in the state may be forced to turn their patients away for good.